Good afternoon, it's Mayor Turner. Today's November 17th. I just got off the press conference with the hospitals and everything talking about COVID. I want to put this as plain as I can. We are in a crisis mode when it comes to COVID in Ector County. We are seeing unprecedented numbers in the hospital. I will give those to you here in just a moment. The Ector County Medical Examiner's Office has requested that a mobile morgue be moved into our community. This mobile morgue will be parked at Ector County Coliseum from the last information that I have. This is because we do not have room to put all of the people that are passing away from COVID. At Medical Center, they have room for 6 deceased individuals. ORMC does not have any room. And unfortunately, we are seeing numbers like we've never seen with COVID. We've talked the entire time about COVID, about the big spike. This is the big spike. To give you an idea of what we were seeing at Medical Center Hospital, they have had, upwards of 40 or 50 or 60. As of today, they have 102 people in the hospital right now. They have 93 that are positive for COVID, and they have 9 that they believe are positive, but they're having to wait for the test. We are seeing lag times for the test for 2 or 3 days because of the number of tests that are being done in the Permian Basin. Right now, out of those 102 patients, 24 are on ventilators. That is the highest number that I have heard personally throughout all of the press conferences. What we're seeing in our region, down to Pecos, all of the small hospitals are having more patients than they normally ever have. Some of these hospitals can only hold 10 to 15 people. They're seeing 14 people in some of these, many of which are on ventilators. And it's very scary for some of those because they do not have the respiratory therapist. They do not have some of the things that we have, luckily, in our hospitals here in Odessa. Over at ORMC, they currently have 144 tests that are pending, that they're waiting for. They have 27 in-house right now. They are opening up more area so that they can have at least up to 35 patients. And that will be at their capacity. Right now, the hospitals are planning for the future. They are planning a couple of weeks ahead. We've talked about now that we're going to have a portable morgue in our city. Now they are actually starting to talk about using tents to put people in because you will run out of room in these hospitals. I'm not saying this to scare you. I always told y'all I will give it to you straight, the good, the bad, the ugly, that you need to know so you can make decisions for your family. Right now, Medical Center has 3 floors. They're opening up their 4th floor. One of the biggest problems our hospitals face is the amount of labor that they have that is out sick. Medical Center, they have 74 employees that are either positive with COVID or been exposed, so they cannot work in the hospital setting. Right now, ORMC has 37. So that's over 120 that we're seeing with these numbers, and simply they can't get back in there. ORMC has addressed one issue that they're having. They said families will call to the COVID units to ask how their loved one is doing it. They are having to change their procedure because they do not have someone that can just answer the phone. Everybody is in a room taking care of people. So they are short-staffed in that way, and that is causing some concerns. One of the problems that they're having in some of the surrounding areas in the smaller hospital is oxygen, because everyone is using so much oxygen, because if you are a COVID patient, it attacks your lungs. We all know that. And they have to have oxygen to keep you, to get enough oxygen in your body. Dr. Benton, who is the health department's physician, he also works at Medical Center Hospital. And he said, the upward trend is continuing. Unfortunately, we don't know if the Ector County Health Department is going to put out any numbers because they're having trouble with data entry. and dealing with the number of cases that they're working through. So what can we do? The city is going to be working with the box stores to make sure everyone has masks when they go into the stores. I know wearing a mask is a political issue, but now we're talking about what is best for the community. If you don't want to wear a mask, you are risking other people. You can say, well, I've heard masks don't work and all this kind of stuff. If you and I are in Albertsons, I'm not wearing a mask, you're not wearing a mask, and I sneeze and I have COVID, odds are you're going to get it. Plain and simple, masks save lives. I guess 30 to 40% probably in our community are wearing masks. We can get this number up to 70 or 80. We can be able to slow this thing down and make it manageable. It's getting to the point where it's not going to be manageable. We've talked in other videos about Amarillo. We've talked about Lubbock. We talked about El Paso. Lubbock is already working on the tent system for their hospitals. So is El Paso. El Paso also has 4 portable morgues to handle the number of people that are passing away. Please, listen to me, social distance, make sure that you stay away from large groups. We are going to discuss about things the city can do to even tighten up more. If we do not get this under control, I am going to have to make the decision to back the economy up from 75 to 50. We have to get these numbers down. It's not a political issue. It is a hospital issue right now. These men and women that work in these hospitals have worked for 9 months watching patients die, watching people they know get sick, and they've been doing this for 9 months. We have to do what we can to help take care of them. If you won't do it for me, fine. Do it for those in the hospital. Tell them thank you. Pray for them. Prayer is probably one of the most important things we can do right now, is pray for the community. Pray for the nurses, the doctors, respiratory therapists, those that answer the phone and everything. This is something that we have to take care of. Nobody else can do it for us. We have to decide individually that we are going to take the steps that we need to. We've already seen a rise from the cases from all the parties that everybody had for Halloween. Thanksgiving is scaring the healthcare professionals because they know families are going to get together. Somebody may be sick, somebody may not be sick. If you won't wear a mask for your community, wear it for someone you know. I have a granddaughter who's diabetic. I wear a mask because of her. I have a mother who's in her 80s. I wear a mask to make sure she doesn't get it. So please, please, please listen to your community leaders and do what you need to do. God bless each and every one of you. We will get through this. I'm not saying there's not going to be some tough times between then and now. Between now and then. One thing that we do have coming, the vaccine is coming. We've heard it may be end of next month. We heard it may be January. Once we get to the vaccine, we can start to take care of some of these populations that are more susceptible to COVID. We can give the first responders, the nurses, the doctors at the hospitals, those in the nursing homes to make sure they don't get it. And we can start to slow this process. But we have to get there first. So God bless each and every one of you. Please, please pray for your city. And I will send out another message when I can. Thank you very much.